Good afternoon. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. So please show your faces in the video. Reminder, please take the online Learning Combi evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one shown here. I have placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation. Requests. Please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Ready? 1. Okay, about you, Chris? Are you joining us, Chris? Okay, ready? Get ready. 1, 2. Okay, get ready. Okay, 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled National Cancer Awareness Week this year. This is in consonance with the DOH calendar, health calendar. So the empowerment objective is for the lay people to have an understanding of the fundamentals and generalities of thyroid cancer in their health management. The contents will be the following. When is the National Thyroid Cancer Awareness Week in the Philippines? What are the objectives? Why? How do we observe it, you and me? What are my specific contributions to the Awareness Week in the Philippines in 2023? And what are the objectives, target impact, target outcome of the week? What are the focus contents of my talk? I'm going to show you another outline on this. And then recognition of ROJoson thyroid cancer survivors and sharing of experiences. So when is the National Thyroid Cancer Awareness Week in the Philippines? The Philippines through Republic Act number 10786 approved in 2016 observes the National Thyroid Cancer Awareness Week every 4th week of September every year. So what are the objectives of this Cancer Awareness Week? To ensure a meaningful observance of the week as herein declared, a comprehensive public education and awareness program shall be undertaken to discuss the causes, the consequences, diagnosis, treatment, and prevention of thyroid cancer. So this is stipulated in that Republic Act. And how do we observe the week? For you, I suggest you make an effort to know the causes, consequences, diagnosis, treatment, and prevention of thyroid cancer by reading, by attending lectures, talks by other professionals, other groups like DOH, and also my talk today. So examine your own body for a possible thyroid cancer. Do a self-examination of your thyroid gland as well as consult a physician for a check or if you have symptoms of thyroid disorder. So if you do all these things, you are empowering yourself. You are contributing to the goal of the Awareness Week, which is to lessen the number of Filipinos suffering or dying from thyroid cancer. As for me, what are my specific contributions? So this is my main contribution is to give this talk on thyroid cancer awareness. This is part of my patient empowerment program, as well education for health development in the Philippines. So I will align my pep talk with the objectives of the national program of DOH. However, I will try to make my pep talk down to earth, reasonable, simple, practical, cost-effective, efficient, etc., hopefully to better achieve the impact of the national program. I will target at least 10 Filipinos who will pass the ROJoson on thyroid cancer awareness. So this will serve as one of my key performance indicators of my contribution. At least 10 of you will take the Olete and pass it. So my request, please take and pass the Olete. The objectives will be the following: to create awareness among Filipinos on thyroid cancer for those who are still not aware, and to create more awareness among Filipinos on thyroid cancer for those who have some knowledge already on thyroid cancer. Most of you, I think, have attended this lecture already last year. Okay, this is just a refinement. Because last year we also have this National Thyroid Cancer Awareness Week 2022. So this is a reinforcement for those who have attended that. So, and at least awareness on the following: the causes, the consequences, diagnosis, treatment, and prevention of thyroid cancer. So this awareness will be measured by my Olete, as I mentioned. So please take the Olete to achieve my objectives, at least 10. So through education and patient empowerment, I like to have this targeted impact to lessen the number of Filipinos dying and suffering from thyroid cancer because of late consult and diagnosis. So I will try to promote this early diagnosis and treatment in my pep talk this afternoon. To lessen the number of Filipinos dying and suffering from thyroid cancer because of late diagnosis, late consult and treatment. Okay. So the impact, I agree that I have to admit I cannot be able to save all Filipinos and to prevent death in all and to prevent suffering in all. This is unrealistic. So it cannot be 100%. Lessening the number is more realistic and reasonable. So that's why the realistic and reasonable strategy is just to promote early consult and early treatment to lessen the number of death and suffering. Again, I have to confess that I will not be able to measure the impact of my pep talk. That's why I said I will just measure just count the number of Olete passers, at least 10. Targeted outcome, as I said, at least 10 Filipinos are empowered based on the Olete results. Okay. At least 10 Filipinos among you pass the Olete on the following. So please take the Olete so that I can achieve my targeted outcome. As I said, I will present the focus contents of this pep talk on thyroid cancer. So what is thyroid? Where is the thyroid gland? What is thyroid cancer? What are the causes, ways to prevent thyroid cancer, when to suspect one may have thyroid cancer, how to self-screen for thyroid cancer, and how to do self-examination of the thyroid gland. What are the consequences of thyroid cancers if not diagnosed and treated early? What cost-effective diagnostic tests are usually being done for thyroid cancer suspect? What are the usual treatment for thyroid cancer? What is the prognosis after treatment for majority of thyroid cancer with early treatment? So let's start with the first topic. Where is the thyroid gland? The thyroid gland is located in the front of the neck and the central neck, sa gitna, okay? So normally, the thyroid gland is not palpable or barely palpable. So hindi niyo makakapa ng maigi yan. No? Okay. If it's not palpable, it's not enlarged, there's no nodules, most likely it's normal. So what is the thyroid? What is a thyroid cancer? It's a cancer originating in the thyroid gland. That's why it's called thyroid cancer. The three common types in the Philippines of the thyroid cancers are the following: papillary carcinoma, which is the most common, then follicular carcinoma, next most common, and then anaplastic carcinoma, the least common among the three. There are other more not very common or rare types of thyroid cancer like medullary carcinoma, lymphoma, and others. But this we just focus on these three more common ones. What are the causes of thyroid cancers and then ways to prevent? So except for people with excessive exposure to radiation on the neck, basta may radiation to the neck, medyo risky yun, the cause is not known. Anybody can have thyroid cancer with exact cause not being established. So kahit na ako, pwedeng tamaan ng thyroid cancer. Anybody of us can have thyroid cancer. It just appears. We don't know the exact cause. Except for the, as I said, except for the excessive radiation, now there is no other known cause of prevention. So if you want to avoid thyroid cancer as much as possible, you avoid excessive radiation. When to suspect that one may have thyroid cancer? The starting point in suspecting thyroid cancer is the palpation of a mass in the front central neck where the thyroid gland is located. Okay. The mass may not be visible but palpable. So kaya importante kinakapa ninyo yung leeg ninyo. Kung minsan hindi niyo makikita na kasi maliit pa, pero palpable siya. So you have to palpate your neck regularly. So it can be, the thyroid cancer can be of any size, 1 centimeter, 2.5, 1.3, ganon, okay? Or any number. Kuminsan isa lang, kuminsan marami. So example, ito, medyo maliit lang ito, isa. No? Ito, medyo malaki, may bukol siya, pero we still don't know kung cancer ito o hindi. It has to be investigated pa rin. Ganun din dito, mas malaki, baka involving kasama na yung the other lobe. No? Yung thyroid gland, it consists of right lobe and left lobe. No? So ito, mukhang multiple, more than one bukol-bukol dito, right and left, dyan. No? So just by looking, makikita niyo may bukol yan. So we start saying that this patient is goiter. So the next is to determine is it cancer or not. So pagtingin lang, hindi pa masyadong malalaman kung cancer o hindi. So kailangan kapain pa. No? As I said, the starting point is suspecting thyroid cancer is the palpation of a mass on the central neck. So to make sure that this mass is part of the thyroid, we have to make a maneuver. Now the maneuver is you just swallow. If this nodule moves up and down with swallowing, 99.9% it's originating from the thyroid gland. So example here, before swallowing, dito sa baba. Nung nag-swallow siya, gumalaw lang konti. No? Okay, up and down. So pag gumalaw siya with swallowing, most likely it's a thyroid nodule or mass. I said starting point because the mass, all of this, pwedeng benign, malignant. Pero you start suspecting possible cancer if you see or palpated these masses. Bukol ang starting point palagi. So, just to reinforce what I mentioned about suspecting thyroid cancer, you don't suspect thyroid cancer if there is no palpable mass. So, kung wala kayong nakakapang bukol, no, at walang nakakapangbukol yung mga doktor, most likely wala. Now, most likely, 99% wala. So, but the thyroid mass seen on ultrasound and other imaging studies would also prompt suspicion for the thyroid cancer. So, as we all know, maraming nagpapagawa ng ultrasound of the thyroid. So, may mga bukol-bukol dyan. So, kung may bukol, that will be the starting point also for suspecting possible thyroid cancer. But not all masses seen on the ultrasound are thyroid cancer. So the advice is to palpate your neck regularly at least once a month. So again, if there is no palpable mass, kampante na kayo, huwag na kayo matakot. So don't worry about thyroid cancer. So how to do self-screening for thyroid cancer? One is to do a neck and thyroid self-palpation monthly as much as possible, starting at age 18 and onwards. So if a mass is felt, consult a physician right away kung may nakapa. So that's my personal recommendations. How to do self-examination of the thyroid gland inspection muna, stand in front of a mirror, okay, ready with a glass of water kasi you have to swallow. So you have to drink the water para gumalaw yung trachea up and down na pag lumulunok kayo, and then try to see if that kung may mga bukol, kung malaki yung thyroid gland mo that moves up and down with swallowing. Kung meron, positive ka for a thyroid gland disorder or what we call goiter. No? Goiter is any disease or disorder of the thyroid gland. Hindi pa specified kung anong klase. Basta goiter lang. So we have to go further and try to determine whether the goiter is malignant or benign or other causes like hypothyroidism or hypothyroidism. Pag wala tayong nakikita, tumataas, bumababa, most likely normal, pero hindi pa tapos yan, kakapain pa rin. No? So you have to palpate. So do a self-palpation of the thyroid. So ilalagay mo lang yung kamay, ihag mo lang yung windpipe or trachea, no? Yung daanan ng hangin. So you can use one hand or two hands, pwede rin, okay? And then drink water. Then as you swallow, try to feel for a lump that will glide between the trachea with the windpipe and your fingers. Kung may nafe-feel kayo may bulging dyan at nag-move up and down in that area, most likely it's you have a thyroid disorder or goiter. No? So you have to determine kung malaki siya, enlargement, or bukol-bukol. No? Kung bukol-bukol, then may possibility na thyroid cancer na siya. No? Okay, possibility lang. No? So, pero fortunately, majority pa rin ng mga bukol sa thyroid gland are still benign. Fortunately. Okay. So, eto, pag ginawa mo yung self-examination of the thyroid gland, two possible scenarios that you'll be able to encounter will be enlargement, malaki. Sabihin natin, ito yung outline ng normal size of the thyroid gland, pero malaki siya, so enlargement. So enlargement, usually we say that there's a goiter already, may abnormality. But usually when you have enlargement, we don't talk about thyroid cancer, okay? We talk about hypothyroidism or hyperthyroidism. Na, kung sobrang secretion ng thyroid hormones, then you call that hyperthyroidism. Kung kulang naman, we call that hypothyroidism. So aside from the enlargement is meaning yung parang lumaki lang, no? Parang namamagalang, okay? You have the nodules, mga bukol-bukol. Okay? Nodule can be single or multiple. Okay? So dito na ang ito yung may pinag-uusapan na kung cancer ito o hindi, no? Okay. So a general guide is kung isa lang yung bukol mo, mas malaking chance na mas malaking chance na malignant siya kung isa. Kung marami, baliktad kasi natatakot tayo sa marami. Kung marami, mas malaking chance na benign siya based on statistics. No? Okay. Tatandaan lang ninyo. Pag maraming bukol, mas magpasalamat kayo, magswerte kayo na most likely benign siya. Compared to isang bukol, na pag isang bukol, mas mataas ang chance na baka cancer siya. So as I said, kung enlargement lang siya, it's not a thyroid suspect. We suspect hyperthyroidism or hypothyroidism. Pero pag may bukol, then we start worrying about thyroid cancer. Okay. So as I said, if there's no palpable mass, again, don't worry also about thyroid cancer kung wala ito, kung wala itong mga bukol-bukol. Okay. As I said, possible findings on self-examination. So if the thyroid nodules or masses are palpated, thyroid cancer is a possibility. So we have to prove that it is not through examination, palpation by a specialist, or if needed, do a biopsy or an ultrasound will have to be done. So ito yung mga how to interpret, no? So you suspect kung may bukol-bukol, okay? You suspect thyroid cancer if the lump, kung isang lump lang or multiple lumps, kung matigas, hard inconsistency, yung tigas na, kasing tigas ng buto, ganon. And then fixed means hindi siya gumagalaw ng husto o nakadikit sa balat, nakadikit sa bed, sa ilalim, no? Hindi siya masyadong gumagalaw. Okay? In contrast to yung mga gumagalaw na husto, no? Mas malaking chance na benign kung gumagalaw. Pero pag nakapirme, kahit na nagsaswallow kayo, no? So you have to start suspecting cancer. So hard and fixed, and then ito pa, kung merong mga symptoms of mga invasion, mga spread, so persistent and progressive hoarseness, kasi yung cancer pwedeng invade yung nerve na dumadaan sa likod ng thyroid gland. Malit lang nerve yun sa likod, no? Kung katabi ng cancer tumor yung nerve, pwedeng maipit yung nerve, kaya you can have hoarseness of voice. So usually pag walang hoarseness of voice, usually hindi pag wala kang hoarseness of voice, pwede pa rin may cancer kung hindi pa maabot doon, no? Pero kung wala, usually we don't usually, I mean, kung meron, we suspect cancer, no? Pero kung wala, pwedeng depende na sa hardness and fixation and other findings. The other findings is kung may bukol dito sa leeg. Okay, kasi it's a sign of spread, no? Dito sa side, lymph nodes ang tawag doon. Or baka meron siyang bukol sa ibang malayo sa leeg, like the scalp, sa ulo, okay, or sa bones, or sa lungs. So ito yung tinatawag na distant metastasis. So kung meron mga bukol sa bones, sa lungs, and the brain, no, and the scalp, then that's a distant metastasis. So we suspect cancer. So example, ito. Sa tingin lang, nakita niyo, mapula-pula na, maitim na itong balat, most likely nakadikit na sa balat. So this is already fixed, and if kung pakapain niyo, most likely matigas yan. Okay? So, pag nakita niyo yung ganung nakakatakot tingnan, no? Maitim, at most likely, pag pinaswallow mo siya, hindi siya masyadong gumagalaw, at sa tingin lang, nakikita niyo nakadikit na sa balat, no? Kaya yung balat umitim na eh, no? So ito ganun din, no? Maitim na, so ibig sabihin naka-invade na siya sa balat. Okay? So cancer ang sinususpect natin dito. Kung lymph nodes meron, kung may bukol siya doon sa leeg, plus you have a lymph nodes, then we suspect cancer also. Okay? Yeah, during examination of the neck of the thyroid, palaging kasama yung examination of the neck nodes, no? Ito yung sinasabi ko, yung kung may thyroid nodule, tapos merong isang bukol na malayo doon sa leg, no, sa skull, no, you start suspecting thyroid cancer already, no? Kasi baka connected itong dalawa, no? Ito yung thyroid cancer na nag-spread doon. So that will be a cause for suspecting thyroid cancer also. So to repeat, in the absence of cues or alert signs for malignancy, more likely the lump or lumps are benign and not cancer. And fortunately, it's still the more common ones. So between cancer and non-cancer, mas common pa rin yung not cancer. No? And as I said, I want to emphasize also, kung maraming bukol-bukol, no, kadalasan, mas mataas ang chance na benign ito. compared to yung isang bukol lang, no? Okay, mas mataas ang chance na malignant siya. What are the consequences of thyroid cancers? So, number one, lalaki na laki kung hindi tatanggalin, hindi makokontrol, so continuous growth of the mass. And then invasion of the surrounding tissue, yung kinakain yung nakadikit sa trachea, ini-invade yung vocal cords, yung nerve, para which will result in hoarseness, paus ng boses ng pasyente, no? Or spread to the lymph nodes and distant masses. And of course, kung di makontrol, eventually, mamamatay yung pasyente. Okay? So, yung papillary follicular CA, fortunately, makokontrol ito. Majority will not die from it. No? Okay. So, basta ma-opera ng maaga lang. No? But yung anaplastic, yan ang nakakamatay. Mabilis kasi ang takbo noon. No? So, example, ito. Okay, bukol. Okay, it will, nag-umpisa yan, mas maliit lang yan. No? I would imagine, baka yung first time na puna ito, maliit lang, and then over the years, hindi niya pinagamot, lumaki. No? Ito naman, ganun din, dadami, okay, ng mga bukol-bukol. Okay. So, yung papillary cancer, as I said, that's the most common type. No? Fortunately, it's usually spread through the lymph nodes, no, yung sa leeg. And then follicular cancer, second most common type, usually spread through the bloodstream. Kaya the most common site kung may follicular cancer ka, nag-spread siya sa buto at sa lungs. Okay. So this is the behavior of papillary and follicular. Sa anaplastic cancer, ito anaplastic, no? Ito yung mabilis lumaki yan, no? So talagang isasakal yung pasyente to the point na hindi siya makakahinga, hindi siya makakain, kaya usually may tubo. Okay? At usually hindi na matatanggal ito. No? Okay. So, importante yung early recognition, diagnosis, and treatment para we can avoid suffering and death from thyroid cancer. So, para kumisan yung mga early stage nito, kung pinabayaan, magiging anaplastic carcinoma. No? Okay. Or, pwedeng papillary, follicular din, pero lumalaki na to the point na nakadikit na sa surrounding tissues na mahirap tanggalin. What cost-effective diagnostic tests are usually being done for thyroid cancer suspect after physical examination? After physical examination by the doctor, okay, or by you, usually, ultrasound of the thyroid gland, pwedeng isamang inek kung kailangan, pero usually, iba ang charges nito, no? From what I know. Mas mura yung thyroid gland, mas mahal yung ultrasound of the neck. No? And then, needle biopsy, kung may bukol-bukol, no? Needle biopsy. As I said, thyroid suspect, so may bukol. So, the thyroid, meron ding maraming nagpapagawa ng mga doktor na FT3, FT4, TSH. So, these are labeled, these are categorized as thyroid function tests. Okay. So yung thyroid function test is not diagnostic for thyroid cancer. It's more for the functions like kung nagsususpect ka ng hypothyroid or hyperthyroid. So pwedeng hindi gawin ito. No? Pag nagsususpect ka ng mga cancer lang or hindi, no? Mga bukol-bukol. No? So it should not be routinely done. It's a waste of resources. Pero maraming doktor nag-order nito, dekahon, FT3, FT4, TSH plus ultrasound. Yan ang package usually. No? So a picture of how ultrasound is being done. Hindi na masakit ito. Dinadaan lang isang probe dyan. Okay? So madali lang yan. Okay? So but nowadays, because of the maraming modern things coming out, no, pero minsan mga modern things are very confusing, nakakalito, no. So be wary of the readings. Nowadays there are a lot of readings that contains yung mga thyroids, no. Thyroids, thyroid imaging, reporting, and data system. That's what thyroid stands for. So ang daming alarming reports like kung may thyroids 4, thyroids 3, 4, 5, gano'n, no. So importante to consult a clinician, specialist, a thyroid clinician specialist, importante yun. You have to, para ma-interpret and report at ma-correlate yung physical findings. Kasi pag may report ng thyroid 4, nakakatakot na eh. No? So the thyroid clinician, the specialists who are experienced can tell you na baka ano lang yan, baka benign pa rin yan. Needle biopsy, gano'n lang, isang karayom lang, and then hiringgilya, no? Mga 1 minute, 2 minutes, tapos na yan, and then we get the sample, then lalagay namin sa isang glass slide. Then we have this examined under the microscope, no? So ito yung mga cells na nakuha, no? Okay. So kumisan sa itsura lang, malalaman natin kung suspected for cancer or not, no? Especially kung yung clinician, yung thyroid specialist na expert na sa maraming experience na sa ganito, no? What are the usual treatment naman? Surgery is still the primary treatment kung matatanggal. Kung papillary follicular, dapat usually matatanggal yun. No? Okay. Pag anaplastic, yan ang mahirap. No? So, kung yung gagawin ng surgery, it's either total or subtotal. Kung dalawang lobes, yung right and left lobe ang involved, usually total. Kung one side lang, kung minsan pwedeng isang total, one side lang. So we call that subtotal. And then kung may kulani sa leeg, no? So we have to do neck dissection of the lymph nodes. Okay? Kung wala naman, pwedeng hindi. No? Okay. So minimum will be total, subtotal, total, subtotal, okay? Or with or without neck dissection. So after the operation, kung papillary, follicular, no, kung ang evaluation ng thyroid specialist ay mas maganda kung dagdagan para to avoid the recurrence. Kumisan, they will think na baka kasi masyado malaki, extensive, they can add radioactive iodine therapy. So it can be given after surgery just to avoid a recurrence. Best effort lang, wala ring guarantee ito. Then, kumisan radiation, external beam radiation, like yung mga cobalt, yung linear arc, no, may be considered for later stages, yung mga hindi na kayang operahan, at yung mga anaplastic carcinomas, yung talagang hindi mo na talagang ma-operahan, kaya niraradiate na lang. What is the prognosis after treatment for majority of the thyroid cancer and with early treatment? Okay, so let's not talk about the prognosis of late treatment. Kung late treatment, siguradong okay, usually they die. No? So it all depends on the type of the thyroid cancer. The best prognosis, yung pinakamaganda, papillary. Unfortunately, yan ang pinaka-common. No? So next is the follicular cancer. Then the worst. Mentioned anaplastic cancers. Again, fortunately, it's the least common. Kasi ang 5-year survival rate lang nito kung mga pasyente na may anaplastic cancer, usually 7% lang. Dito sa papillary follicular, mataas. Tingnan nyo dito. 5-year survival rate, 97%. No? And then, meron pa rin namamatay, pero konti, 3% lang. No? 10-year survival, 95%, mataas pa. 20-year survival, 90%. No? Then for follicular cancers, although the survival rate is lower than those of papillary, practically halos pareho lang sila. So near the vicinity. So near 100 for papillary cancer and then 98%. Mga 2% difference lang. So maganda pa rin ang follicular cancer. Basta ang pinaka-worst is anaplastic cancer. So my advice is go for early recognition, diagnosis, and surgical treatment for thyroid cancer, basta suspected may thyroid cancer, to have a better chance for cure and to avoid unwanted suffering and death. So now I'm going to share with you my registry of thyroid cancer and recognition, just to show you the importance of early diagnosis and treatment. Okay. So to convince you of the importance of early recognition, diagnosis, and surgical treatment, and to inspire you pag nakita kayo yung mga survivor, ma-inspire ko tayo. No? So I will now present to you my registry of thyroid cancers whom I have treated from 1982 up to the present. So that's about more than 4 years na. So the criterion for inclusion in this registry, yung mga at least 10 years in remission after a thyroid cancer surgery. No? Ito yung basis ko for inclusion in my thyroid registry of cancer. No? Aside from thyroid cancer, meron din akong breast cancer survivors. No? So this is just a partial list because maraming din nagpa-follow up din, kaya nawawala na. So at the moment, at present, I've updated this. There are 25 thyroid cancer survivors in my registry. So the range of remission, yung 10 years after the operation, walang problema. Yung iba, 40 years. So 10 to 14 years. To 40 years. So yung 31 to 40 years na walang recurrence, may 11 out of those 25. And then 21 to 30 years, may 5. And then those with 11 to 20 years, may siyam. So marami rin. No? So only one has been documented to have died of recurrence of thyroid cancer, but she lived for 12 years after the operation. So kung sa 25, one lang namatay doon, 1% lang. Okay, less than 1%. No? Bira. No? So as of 2023, this is the updated list. So may mga actual patients ito. No? Okay, may 41, 36 years in remissions, gano'n. Ito si Letic 1, this patient has also breast cancer. No? So, but for the thyroid cancer, she did not die of the thyroid cancer, 31 years in remission, but she died of the breast cancer. No? Okay, dalawang cancer niya. So, these are the other lists. No? Iba, bago lang dito, ina-operahan ko. No? So, may mga 11 years, the minimum. Okay. So some of the pictures, Ida, I don't know whether Ida is here or not. No? And then, I forget his name. Kalimutan ko na yung pangalan nito. Okay. So these are some of the pictures of my thyroid cancer survivors. Others. Okay. So I'm now ready to close this talk. Summary and takeaway. I have presented all these topics, discuss these topics. I won't read them anymore one by one. Okay, ito yung mga specific focus topics on the thyroid cancer itself. So, a message in the takeaway in relation to the patient empowerment, be always in touch with reliable medical information on thyroid cancer. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, knowledge, kakayanan, capability, karapatan, right, kapangyarihan, self-determination, to gain greater control over decisions in medical management of oneself by knowing the fundamentals and generalities of thyroid cancer in your health management. So that's the last slide. I end my pep talk today. National Thyroid Cancer Awareness 2023. I hope I have empowered you to have a better understanding on the fundamentals and generalities of thyroid cancer in your health management. So before we go to the QA, question and answer portion, reminder, please take the online learning com evaluation test exercise. And then 50 OLETIS certificates will entitle one to a free voucher for ROJoson telemedical consultation. And please type in your feedback in the chat box during the open forum. Let's now have a group picture taking. That's it. 1, 2, 3. Let me save it first. Okay. Okay, the floor is now open for questions, reactions, comments, and of course, I allow free consultation, just short free consultation. Okay, okay, Susan is waving her hand. Okay, Susan,
Good afternoon, Doc.
good afternoon.
Yes, I had papillary carcinoma in 1998. The entire thyroid gland was removed, and I've survived for 20 years. So why do I need to undergo, well, that's what my endocrinologist said, a thyroid ultrasound. Of course, yung TSH ba yun? 3, 4, after, no, every quarter, no? But yung thyroid ultrasound, what is it for? Kung wala na akong thyroid gland.
Thyroid, your endo advised you to have quarterly FT4,
Yes,
quarterly,
yung thyroid, ha?
quarterly, every 3 months.
Yeah, but I don't follow naman.
Okay. Baka,
But the ultrasound.
baka he's not insisting also. Kasi hindi mo lang ginagawa.
And then, actually, hindi ganito. Sorry. I should have had it last April. Kaya lang, I was more concerned with my
Breast.
yung problem sa aking breast. Oo. So, hindi nagawa. But I now would like to know, after your talk, do I really have to have a thyroid ultrasound and a regular thyroid functioning test, something like that?
Okay, so we're now discussing the issue of surveillance, di ba? Surveillance after the operation. So yan ang issue. So how do you do a surveillance of thyroid cancer patients? Okay, so yung mga surveillance program for breast, iba yon, no? Yung ibang surveillance program for other cancers, iba, no? So ang general principles for the yung frequency of surveillance will be, it depends. Number one factor is what is the track records of that cancer recurring? Okay, is it notorious ba siya mag-recur? At kung kailan siya nagre-recur? No? Kung kailan? No? Okay. Example, kung yung thyroid cancer mo, bihira namang mag-recur, no? So you can do it mas malaking interval. Diba? Mas malaking interval compared to a cancer na babalik in 1 year. So you have to do it, yung interval will be lesser, no? Probably 6 months, gano'n. Every 6 months, gano'n, every year, no?
Yeah.
Mahaba, maganda yung prognosis like papillary cancer, you don't have to have it as frequently as one with okay. Pero kamisan, baka may nakita nila, baka may recurrence, may possible, then they will do the exam soon, di ba? Pero kung on palpation, on the, let's say, ang examination mo today, sinabing wala, no evidence of recurrence, no? So you can do it, pwedeng 1 year after, or even longer, kasi you say kasi 20, ilang years?
20 years.
Okay.
20 years. 1998, more than 20 years.
Okay, kung 20 years na, maliit ang chance ng recurrence, no? So you can have it every 2 years, every 3 years, no? Pwede na.
Okay.
No? Ganon. So yung hinahanap, ang tinatanong mo sa akin yung frequency, no? O yung
Yeah.
And also the type of test, no? Okay. Kasi you mentioned also about your thyroid function test. Yung tinotal ka na, you underwent total thyroidectomy. So after the total, wala ka ng thyroid gland. So your body will not be producing enough thyroid hormones. Okay.
Yes.
So you need to have replacement of thyroid hormones. No?
Yes.
So yung thyroid hormones, matatitrate naman yon na you can be given let's say 50 or 100 microgram per day as a maintenance, then
Yeah.
tuloy-tuloy lang. You don't have to have it done every 3 months. No?
Okay.
Okay? Kasi yung FT3, FT4 mo, sine-check lang naman yung ano thyroid hormones functions mo no? Okay.
Okay.
Okay, tell me from your experience in the past, no? I suppose naka FT3, FT4 ka na for several times, di ba? Within a year, naka tatlo ka, no?
Yeah, more than. Oh.
More than. So anong trending ng anong trending ng results mo? Pare-pareho.
Halos
Normal.
pareho, Doc.
Okay. Kaya nga, kung pareho,
Pero ngayon, I am on Tydin 100.
kaya nga, dati-dati, Tydin 150,
125.
125.
Oo.
Since when?
Ano pa, 3 years ago.
Nung umpisa? 20 years ago?
Nung 10 years ago,
Oo.
halos ganun din.
Halos
Seven,
gano'n. Kasi
oh,
kasi by the first year, second year, malalaman ng doktor mo yung yung trending ng mo, thyroid
nag-change
hormone.
ako ng doctor kasi, Doc, eh.
Okay. The moment you change doctors, iba naman. Okay. So, but
Hindi, no. I changed doctors because my doctor is so busy.
kaya
He couldn't attend with us, oh.
Kaya nga, the mere fact that you change doctors, naman, doctors have different mindsets, iba-iba. May maximalist, may minimalist, iba-iba, kaya magulo rin, di ba? So as much as possible, kung you stick to one doctor whom you trust, okay, you try to go for a minimalist physician, then stick to him already, no? Basta may trust ka pa rin, no? Kasi pag ibang-iba kayong doctors, talagang iba-iba yung gamutan, no? Okay? So, but kung may trending na, no? Trending na, you can with 100, sabihin natin 125 iniinom mo for 1 year, di ba? Okay. And then yung T3, T4 mo is within normal, okay?
Yeah.
Hindi naman sobra, no? So i-maintain mo na lang. Pero kung with some examination nakita nila na yung 125 milligrams medyo mataas, pwede pang bawasan, di ba?
Okay.
Kung bawasan to 100 at since after being prescribed 100, i-check mo na, di ba? So after 2 checks ng FT4, kung normal na, pwede nang wala, no? Wala nang repeat test. You just take it mga 1 year, 2, pwede mong i-repeat na lang after 1 year. So wag na yung every 3 months, yung quarterly. So, so personally, I don't subscribe to that quarterly, no? So you just take it probably once a year kung gusto mo. Kung minsan pwedeng wala rin. No? Okay? So yung ultrasound, pwedeng 1 year, pwedeng 2 years, basta kinakapain leg mo. Yung ultrasound kasi chinecheck kung may lilitaw ng bukol dyan sa leg mo. No?
Okay.
So pwede naman kapain na no? Okay. So at 20 years, most likely 1% lang magre-recur yan.
Okay.
1% lang. So kung kakapain yung doktor mo na wala, no? Pwedeng kahit na once a year, once every 2 years, or just rely on the palpation. Okay?
Okay.
Which I think wala rito. I'm just looking for some patients dito. Yung mga pasyente ko naman, hindi ko pinapa-ultrasound every year. Okay. Okay. Basta kapa ko lang and then sabihin ko, right na after pag-check up mo na, kapain ko lang. Kapa lang. No? Okay. Wala nang repeat ultrasound. No? Okay. Okay?
Yes, Doc. Thank you po.
You're welcome. Any more questions? Wala na? Wala pang 3 o'clock.
Hello, Doc. Ako po.
Si Chris.
Please. Hello, everyone. Good afternoon. Good afternoon, Doc. Kasi, di ba, actually, thank you, Doc. At actually, in-accommodate ako ni Doc ng text kasi sobrang nag-worry ako. Nung mga nakaraang araw kasi biglang may nakita doon, nagpa-neck ultrasound ako. Doc, question, kapag sinasabi bang halimbawa, hyper o hypothyroidism, may chance ba na nagiging cancer?
0.0001. Bihirang-bihira.
Thank you, Lord.
Bihirang-bihira.
Thank you, Lord. Thank you,
Hello?
Doc.
Ha?
Noted po, Doc. Thank you so much for the answer.
Okay.
Parang
So,
nakaka-relieve. Kasi either of the two, at least medyo kahit pa paano safe. Pag ganyan ba, Doc? Gaano katagal yung gamutan? Gumagaling pa ba yan?
depende, ano ang diagnosis sa'yo? Hyper or hypo? Yan ang tanong. Diba?
Apa, Doc. Actually, hindi pa ako nabalik.
Okay.
Pero yung ano kasi, yung sa pag-gaining ng weight po.
Oo. Kaya nga, kung hypo ka, usually, tuloy-tuloy yun. No? Kasi replacement na. No? Kung hypo. Kung hyper, because of baka pwedeng after some treatment or baka kusang after medical treatment, baka within 1 year, baka mawala, no? And then pwedeng itigil din, no? Okay. So depende sa diagnosis mo. Yung sa iyo kasi, pinakita mo sa akin yung ano mo, mas suspetsa ako sa hypo mo kasi kung sabi sa iyo pag tumataba ang pasyente, no, usually hypo, hindi naman all the time kasi maraming tumataba, di ba? Pero kung i-contrast natin taba at saka sudden weight loss, no, mas magsususpetsa ka ng hyperthyroidism kung biglang baksak yung weight mo, no? Ngayon, kung tumataba ka, we don't suspect hyperthyroidism, no? It's more of hypo. Okay? More of hypo. Pero hindi ibig sabihin pag tumaba ka, mataba ka, may hypo ka. Ang sinasabi ko lang, when we are analyzing kung anong possible problem sa thyroid mo, kung hyper or hypo, kung hypo, usually weight loss, yung tumataba, no? At usually mga manas yan no? Taba, manas, no? Hypo ang sinususpetsa natin, no? Okay. So yung sa iyo kasi nagpa-ultrasound ka, sinabing maliit, di ba? In-emphasize to na maliit yung thyroid mo. Ibig sabihin, baka may hypo ka kasi may radiation ka for the ano, di ba? For the for your breast cancer.
Opo, Doc, tama.
Kasi nung niradiate ka dun for breast cancer, may kasamang radiation sa leeg yun di ba? Sa upper part.
Opo, Doc. Opo, Doc, meron.
So, tinamaan din yung thyroid mo, no? Pwedeng tinamaan yung thyroid mo sa radiation, no? Kaya baka most likely lumiit siya, no? Okay? Pag lumiit, we now suspect hypo. Okay? Yung hyper naman, kanina yung picture na pinapakita ko sa iyo, kung hyper, usually malaki, na? Okay, usually, na? Pero meron din mga hypo na malaki ang yung thyroid gland, no? Pero kung sinabing maliit, we start suspecting hypo. Okay? So wag kayo magre-rely sa TSH lang, no? Okay. So maraming nagre-rely lang sa TSH, kung minsan hindi rin siya accurate. So you have to add another test, no? Based on yung evaluation ng isang pasyente. Ina-analyze ko yun di ba? Ina-analyze ko kasi tumataba ka kamo, tapos may radiation ka, no? So mas ang suspetsa ko, kung meron kang problema sa thyroid, it's more of hypo. Sana wala. No? Okay?
Sana nga po, Doc. Thank you. Thank you so much, Doc.
Okay. You're welcome. So, any more questions? Abelet. Unmute.
Noong January 2021 po, yung binigay niyo sa aking levothyroxine ay 200 mg mcg. Tapos noong October 31, 2021, 150 na. After 9 months, 150 na. Hanggang ngayon po ay iniinom po yung 150. Siguro yung 22. Magdadalawang taon na ho. Ang napapansin ko lang sa katawan ko, para ako yung nangangayayat. Sobra akong nakakangayayat. Yung gawin, kailangan kong pababain yung dosage.
Kung pwedeng kasi possible side effect yung thyroid the levothyroxine, yung thyroid hormones ang iniinom mo, pwede kang mangayayat, di ba?
Nangangayayat po. At saka naman inakain. Para
Pwede.
lagi nagugutom.
Yeah. Okay. So, that's why sabi ko nga sa iyo, pag may hype, kasi pag dinadagdagan mo ng gamot, umiinom ka, parang nagiging hyper ka eh, di ba? Kasi may dagdag, di ba? So, papayat ka, di ba? Pero hindi lahat, hindi lahat ng pasyente ganoon. So, that could be a possible side effect ng taking the medicine. Kaya minsan ibang pasyente na gustong magpapayat, umiinom silang thyroid hormones, no? Para papayat, di ba? Pero hindi naman dapat gawin 'yon, no? So, yung sa iyo, bago nating desisyonan nung kung babawasan pa, pwede nating bawasan. I-check natin kung pwede nang bawasan. 'Di ba? Kasi minomonitor natin yung mga bukol-bukol mo diyan di ba?
Doc, ang bali ang aking last ultrasound ay May 2023.
Okay. Kaya nga dapat kapain ko rin, 'di ba? Okay, hindi ko pa nakakapayan, 'di ba? Okay. So, mas maganda kung kapain ka muna, then we decide, no? Plus yung ultrasound, no?
Sige.
Okay.
Mag-schedule na lang ho.
Okay.
F to F.
Okay.
Sige po.
Sige.
Sige, thank you po.
Okay. So, any more questions? Sinong may thyroid concern? Si Rochelle, tapos na, no? Alam mo na yung Okay.
Yes, Doc.
Okay. Wala nang iba? So, walang question sa chat box, no? Okay, Abet. Okay. So, if there are no more questions, okay. May mga new attendees ba tayo? Jocelyn Chu. Jocelyn Shirley. Pwede ho bang makilala si Jocelyn? Pwede? Jocelyn? You have any question, Jocelyn? Welcome to this pep talk.
Thank you po for Jocelyn T and invited me to join.
Okay. Yeah.
But she left na. I think she left na.
Okay.
Thank you po. Very informative. Thank you po.
Yeah. Meron kang tanong? You have questions? None. Okay.
I have hyperthyroidism for almost 16 years.
Okay.
Pero ano siya, parang autoimmune, nagiging hypo, nagiging hyper. So I was closely being monitored by my doctor for the 15 years that I have it. So every quarter I have to do the TSH T4. And then pero alam ko pag nag-activate siya, I'm losing around 20 pounds. Then I will take Meneomerdin for sometimes 1 month to 3 months, then I will be going back. And then my doctor is not recommending me to take the iodine, ano ba yun? Yung radioactive. Kasi sabi niya, kasi every time I take the medicine, the Meneomerdin, it will, gumagaling ako, parang gumagaling ako. So in 1 month to 3 months time, I will recover, and then my THS and T4 will be normal again. So, kaya hindi niya ako nire-recommend mag-iodine. So, that's my question, Doc. Sorry.
Sure. No, no problem. Throw the
So,
question.
kasi may one time, it affected my heart, yung pagka-thyroid ko. Sobrang payat, as in sobrang payat na ako. Siguro that time kasi my son also got married, ganon. Tapos, ang sabi ko kay Doc, parang natakot ako kasi sobrang payat, tapos sobrang pagod. Then I was not able to sleep well, ganon ang bilis. So I told I asked my doctor, sabi ko, pwede ba akong uminom na ng iodine para hindi na pabalik-balik kasi this has been going on for 15 years. Tapos sabi niya, ay kung nakukuha naman sa medicine, bakit gusto ko ng aggressive treatment?
Okay.
Yun lang ang
Okay.
ano ko, parang is it not advisable to do the radioactive para I will be hypo forever na? Parang kasi sometimes I lose 10, 20, tapos if people look at me, I mean, I eat a lot, pero I lose 20 pounds at nakikita ako ng mga tao, parang, are you sick? Are you sick? Yung parang ganon. So, yun. So, pero my doctor recommended that since gumagaling naman daw ako sa gamot, why do I want an aggressive treatment? Yan lang.
Okay. So, okay. Can I take a look at your neck? Okay. Wala naman. Hindi mo malaki. Patingin.
I will transfer to a clearer view. Wait, Doc.
Okay lang. We're talking about hyperthyroid, although the topic is thyroid cancer. No problem. I will try to answer your question. Okay. So the starting point is really the diagnosis. No? Basta every time that we treat patient, no, or we undergo treatment, we start with the diagnosis. No? At dapat tama yung diagnosis. No? Kasi kung di tama, magkakalito tayo. No? So yung leeg mo naman is really not enlarged. No? Okay. So 15 years ago, sinabi na may hyperthyroid ka. No?
Mm.
Anong basihan? Kasi if your neck is enlarged, no, saka diffuse, sabihin ko most likely tama, may hyperthyroid, no? Pero if I don't see your neck enlargement, no, may duda ako. Kasi kung minsan nagkakamali rin yung mga doktor doon sa diagnosis, no? So depende sa thyroid function test mo. Anong mataas? Mataas yung T4, TSH, T4? Hindi mo matandaan.
Hindi ko matanda.
Yeah.
Pero yung 2007, I lost around 20 pounds. So, I don't know na, hindi ko alam, parang, then people just notice na, sabi niya, you look sick, go check. Tapos may nagsabi sa akin, check mo T3, T4, and TSH mo. Sure ako may thyroid problem ka kasi sobrang payat mo.
So, ano result? During that time?
Yung time na yun, hyperthyroidism. The doctors, I have hyperthyroidism.
That's 2013?
2007.
7. That was the
Oo.
start? The start?
The start, yes. The start.
Okay, 2007, the start, pumayat ka. Okay?
Oo.
So nagkaroon ka ng thyroid function test, hyperthyroid ka, lumabas. Hyper. Okay, kung ganon, so maliit ang leeg mo, kasi may mga pasyente na malaki ang leeg, no? May hyperthyroid kasi hindi na gamot kagad, no? So may tatlong options, no? One is medical treatment, no? Yung iniinom mo ngayon, baka PTU or Tapasol or Metimazole, yun ang mga gamot, no? Number 2 option is radioactive iodine, no? Number 3 option will be yung surgery, di ba? O papaliitin, no? Kung yung maliit yung leeg mo, usually we don't do surgery, no? Okay? So you're left with that gamot or RAI kung maliit, no? Okay? So sinabi ng mga pag nag-RAI ka, Ang side effect noon, you will have permanent hypothyroidism kasi mas susunugin yung thyroid gland mo by the radioactive iodine, no? Tuloy-tuloy yon no? Okay. So they try the medicine on you, di ba? Okay yun, no? Okay, which I will also do, no? Kung maliit lang yung leg mo, we try yung medicine and then just keep on monitoring. Keep on monitoring kung minsan nawawala na totally, no? Meron ako mga pasyente na transient lang hyperthyroidism, nawawala, no? So you just have to monitor yung ano mo, thyroid function test mo. So what medicine are you taking now?
Neomerdin. It's always parang Neomerdin parate.
Okay,
But
so anti-thyroid, we call that anti-thyroid, that's for hyperthyroidism pa rin. Okay. So anong dosage nun?
Now I'm in normal na yung thyroid ko. My last is December when I lost around again 20 pounds. But now I've been taking it for 3 months. Then my latest blood test for the TSH and T4 is normal na. So
With medicine.
Neomerdin pa rin.
Yeah, with maintenance of medicine.
Yes. Pero nag-stop na ngayon kasi the doctor stopped it. Pag nag-normal na siya for a while, for 2 to 3 months, ini-stop na niya.
So from your experience 2007 up to now, once you stop it, bumabalik.
Not necessary. Kasi may mga year na like 2007, tapos bumalik siya ng 2010, bumalik siya ng 2011, tapos bumalik siya ng mga every 2 to 3 years bumabalik. Tapos ang recent ko is nung nag-COVID 2021 and then last year 22 bumalik na naman.
When
so
you
the
say-
whole of 2021 bumalik siya, tapos 2022 bumalik na naman siya. So
Okay.
the whole time of the pandemic I am sobra akong payat. Sobra ako mga 124 lang ako. But now I'm in my regular weight, 146 na ulit ako.
So when you say bumabalik, wala kang gamot. Ininto?
Meron, ang last niya is parang 2018, tapos nung 2021 bumalik.
I want to know, when you say bumalik, bumalik is nag-recur yung hyperthyroid mo without medicine.
Yes, bumabalik pag without medicine.
So
Kasi
tinitigil ng doktor mo yung medicine.
oo, kasi naka-hypo ako Doc.
How long usually tinitigil niya bago?
May time na 3 months, may time na 4 months, may time na iba-iba, Doc.
So after 4 months, ganon, nag-hyper ka.
Nag-hypo na ako, titigil na niya, tapos for a year or 2, normal ako. Pero every quarter, nagpapa-blood test ako.
Without the medicine. Without the medicine for 1 year.
Without the medicine, I'll be okay for 2 to 3 years. Tapos may trigger na naman, I don't know what. Tapos bigla na namang, alam ko pag bumabalik siya, pumapayat talaga ako ng mga 15 pounds agad. Yung iba, yung walang ginagawa, basta sobrang in a week time, I will lose 5 pounds a week.
5
Parang
pounds. And then when you
oo.
check it, talagang hyperthyroid.
Oo, more or less, parang 90% sure na ako na may thyroid. Maski hindi pa time for me to check, I'm sure my thyroid is not okay na naman. Parang ganun.
Okay. So, do you check your T4 and also TSH? Dalawa?
Yes,
Or just TSH?
quarterly. With medication, without medication, for the past 16 years, quarterly ako nagpapacheck ng T3, T4, at THH.
Okay. So, at least okay na yun. Gamot na lang, no? Gamot na lang, just monitoring lang. Kung talagang documented na bumabalik, then, kasi usually kung hyperthyroid ka, usually tuloy-tuloy yan unless you take the medicine for life, di ba? Okay. Pero yung sa'yo, you can afford, you can afford to stop it for a while, mas maganda nga yun, no? Kung bumabalik, then just take it, no? At hindi naman lumalaki yung leg mo, that you're still lucky, hindi lumalaki, di ba? It's not big, no? Okay, that's nice.
So, ang ano ko lang, Doc, so it's not advisable to take the radioactive,
No more with your history.
okay. So, yun, ganun na lang. Parang,
Yeah.
kasi ko lang parang, wala lang, I'm just thinking kasi biglang, yun nga, papayat ako ng sobra. Tapos parang naisip ko lang na parang once and for all na parang i-radioactive na para no more hypo na forever. Is it not advisable?
If you take the RAI, most likely you will go into hypothyroidism. No,
Yes.
then you still have to take medicine replacement. No? Okay. So, sa akin, you just anyway, pwede namang itigil yung gamot mo, di ba? Yung thyroid. Ganun na lang, you just monitor mo. No.
Okay.
Monitor mo na lang. Who knows, baka eventually, kasi umabot din ng 1 year na wala, di ba, Kamo? 1 year or 2 years.
1 year, may time na 3 years, wala.
Okay. Kaya nga, baka there's still a chance baka so-called outgrow mo. Baka ma-outgrow mo. Okay, that you don't, baka eventually, mag-normalize na yan. Hindi na, Okay.
Sige. Thank you, Doc. Thank you, Doc.
You're welcome. You're welcome. Okay. You're welcome to join us every Saturday.
Okay, thank you. Thank you.
Any more questions? It's 3:13, so if there are no more questions, we'll call it a day. So we'll see each other next week. No, I still don't know the topic, but I might go for a gout. Talk about gout. No, okay. So we'll see each other next week again. Bye-bye.
Thank you, Dr. Ray.
Thank you.
Happy weekend.
Doc.